And a good afternoon to you. I'm Al Cresta. The Obama administration has taken another step in what amounts to a 4-year plan to make abortion-covered health insurance subsidized by the federal government, commonly available in the United States. My guest, Doug Johnson, is legislative director at the National Right to Life Committee. He's done the definitive analysis of this new Health and Human Services rule on abortion coverage in the health care bill. And Doug, it's good to have you back. Thanks.
It's good to be with you.
This is 644 pages for a rule?
Well, that's right, and we have to keep in mind we're talking about ObamaCare. It's a massive law. It's a book of law, and it contains innumerable provisions, new programs, hundreds and hundreds of authorities granted to the Secretary of Health and Human Services and other executive branch agencies and officials. So it's going to be a long rollout if this thing is allowed to go into full effect. It's going to do all the bad things that we warned about when Congress was considering it and more, but it happens in slow motion.
Yeah.
This particular rule deals with things that are going to kick in January of 2014 unless Congress steps in to repeal and replace Obamacare before that.
Now, tell me, what is this particular rule that we just learned about on the 12th of this month?
Well, this concerns mainly what are called the exchanges. These are government-administered insurance markets that are going to be set up in every state, and they won't initially include all health insurance plans, but eventually they probably will.
Okay.
More and more plans will be sucked into these, and the most important thing to understand here is that there's a big new government program created by ObamaCare, which is going to help tens of millions of Americans buy these health plans. So a great deal of federal money is going to flow into these exchanges, through these exchanges, to help millions of Americans buy health insurance. For people with family incomes up to 400% of the federal poverty level, so we're talking about family incomes of $92,000 or something like that, are going to qualify for these federal subsidies. And the plans that cover abortion on demand qualify for these federal subsidies. This is what we've been talking about all along. This is a sharp break from decades of federal policy where federal funds could not go to subsidize funding of abortion.
I thought the president promised in a joint session of Congress back in 2009 that no federal dollars would be used to fund abortion.
Well, those are all word games. Words mean what he wants them to mean, not what they mean in ordinary English, you see. But we've had decades of federal policy where what that really meant was that federal funds didn't go to a health plan that paid for abortion on demand because, of course, when the government pays for a health insurance plan, it pays for what the insurance pays for.
Right.
And in this case, for very many of these plans, it's going to include abortion on demand. Now, to try to cloak that, they came up with this language in the Senate, which is part of the final law. And this rule now spells out some details where they segregate the cost of the abortions. And the people who end up enrolling in these plans are then told that they're paying an extra amount every month to pay for abortions. Now, you don't find this out until you're in the plan, mind you, because they've put in a prohibition on telling people. I'm not making this up. It is prohibited to tell people that the plan covers abortion until they get the material describing what they've just enrolled in.
Unbelievable.
At that point, you're paying for it. But this is just a bookkeeping device. The big money is coming in from the federal treasury to help these tens of millions of people. One estimate is up to 57 million people are going to be getting these subsidies. And not everybody is going to be in a plan that covers abortion, but a lot of people are. And a lot of people are going to end up enrolling in them without knowing it. Now, if you happen to be lucky enough to live in a state where the state legislature has acted proactively and said, we don't want any abortion in our exchange, then that's very good. But you're still going to be subsidizing abortion coverage in every other state that doesn't have such a law. Your taxes are going to be subsidizing coverage for abortion on demand in New Jersey and New York and California and so forth.
No.
So this is what we've been talking about.
When a person enrolls So everybody will have to enroll in some kind of plan.
Yes.
And every plan will cover abortion?
Not every plan.
Okay.
A state can actually pass a law saying they don't want abortion in the plans that are in the exchange in that state.
Who can determine that? Is that a decision by the state? Okay, that's the state.
The state legislature
All right.
has the authority to say, in our exchange, in our individual state, we don't want abortion as part of these plans in the exchange. And a number of states have passed such laws already, and National Right to Life affiliates have been working to pass more of them. But it doesn't fix the whole problem because you're still subsidizing the massive abortion coverage subsidies that the federal government is shoveling out to all the other states, including some of the biggest states, which aren't going to pass those types of laws. So this is federal subsidies for abortion on a massive scale. It is a sharp break from the principles of the Hyde Amendment, and it's certainly contrary to what a lot of people were led to believe the president's position was, although we always knew that that was a scam.
Right. Right. What is this? There's been a lot of comment circulating on the internet the last few days about this $1 surcharge.
Well, it's actually worse than that.
Okay.
It's part of the smokescreen to try to conceal the most important thing, which is the big federal subsidies for the abortion coverage. They've set up this bookkeeping scheme. And the rule in the law doesn't actually say it's only $1 a month. It says no less than $1 a month. Okay. So it could be a lot more than $1 a month. And again, this is part of the premium people are going to find out about after they've enrolled in a plan.
Because you can't learn this before you enroll, because that information
you might learn it if you're very diligent in your research. Maybe you can find it somewhere, but they can't tell you because the federal government has prohibited the plans from telling you in advance. This plan A, covers abortion, and Plan B doesn't. It's explicitly prohibited to tell you that in advance. Now, once you've so unless you're really proactively researching through outside sources or whatever, you're not going to be able to tell the difference until you sign up. Now, once you sign up, they're going to send you some kind of statement that says, by the way, you've signed up for an abortion covering plan, and X dollars of your monthly premium are set aside for abortions. Now, you might say, I don't want abortion coverage. I don't want it. I'm morally object to it. It doesn't matter. There's no opt-out. At this point, they've trapped you, and that is the very intent of this gag rule provision, which Senator Barbara Boxer got in the law. Of course, we opposed all of this, but it was enacted over our objections.
My guess, by the way,
want you to know.
My guest, by the way, is Doug Johnson. He's legislative director of the National Right to Life Committee.
So you're being told that X dollars, it could be $1, it could be $10, whatever the plan sets, is being used for other people's abortions, whether you like it or not. But worse than that is that your federal tax dollars are subsidizing the abortion coverage on a far larger scale.
Okay, so we got the surcharge, but our federal tax dollars are subsidizing abortion on a much larger scale, you say.
That's right.
They have us coming and going, it sounds like.
That's right.
Yeah.
They've actually added insult to injury, you might say, in an attempt to cloak the federal subsidies and to say it's not really federal funding because we're getting the money from somewhere else. They're also telling every enrollee in the plan that, by the way, we are using X amount of your premium every month specifically for abortions. Wow. And there isn't anything you can do about it, except, maybe a year later you can change plans and try to find one that doesn't cover abortion. And there will be some plans that don't cover abortion, but you're going to really...
Okay, but if you're in a state that has the exchanges in these, once a state determines that it is permitting abortion in these plans, you won't have any options, will you? In that state?
Yes, there's still, even if you're in a, quote, bad state where the legislature hasn't passed a law, what we call an opt-out law, there's still supposed to be at least one plan in every state that does not cover elective abortions, at least in the short term. Now, they've kind of booby-trapped that.
Who will administer
ways.
Who will administer those plans? Yeah, who will administer those plans? Will that be through employers or through the state? How do you purchase that?
These exchanges are going to have a mix of plans. A lot of them are going to be private sector plans that choose to go and sign up to be marketed through the exchange. Why will they do that? They'll do it primarily so that they can qualify for these federal subsidies, because this is going to be a huge amount of money.
Right.
Again, the estimates have varied from 17 million to 57 million Americans will qualify for these subsidies. This is a massive new entitlement program.
So the incentive...
So the insurance companies are going to want to get into the exchange so they can sign up these federally subsidized clients, plus which the federal government is going to be starting its own plans called multi-state plans, which are going to be offered eventually in every state. And,
what, Doug? We've got about 60
seconds. And we fear
seconds.
that some of those plans are also going to cover abortions, but they haven't said yet explicitly that that's what they plan to do. They said they'll tell us later. We think later means after the election.
Let me come back to something very basic for our listeners here. We've got only about 45 seconds. The president originally promised that we would not be paying for abortion, that there'd be a respect of conscience rights. It sounds as though that there's no real respect here for conscience rights.
Well, of course, there's many evidences of what you just said is true, including the whole separate issue of how they're using a different provision of Obamacare to mandate that health plans cover services to which employers, including religiously affiliated institutions, are morally opposed.
Yep.
And we expect that they will expand the use of that authority if Obama is reelected as well.
Yeah, unbelievable.
That's a whole separate problem. This is a massive law, and there are lots of ticking time bombs in it.
Doug, thank you so much for your work, for being on top of this, and we're going to continue to inform people of your analysis. This is something people have to get in their hands. Thanks so much.
Thank you.
Doug Johnson is Legislative Director at the National Right to Life Committee. He's done the definitive analysis of the new Health and Human Services rule that was laid out on March 12th. This is unbelievable. It just keeps coming. Again, get to stophhs.com.